Hi, I'm Dr. Sonya Doherty, and this is my sister, Dr. Carissa Doherty, and we are here for the last and third part of our burnout series of videos. Unfortunately, our families, our patients have been through a tremendous amount in the last few years, and we're seeing it come out in different ways. One of them is anxiety. So I know I treat a lot of children, and honestly, it's been devastating to see the level of anxiety and pediatric mental health that we're facing. Naturopathic care can make it easier, whether you're choosing naturopathic care for a primary support for anxiety, or if it's to support what you're already doing, maybe with a medication or CBD, meditation, exercise. There are so many great safe supplements that can help with the biological or medical aspects of anxiety. So Chris is going to go through a presentation that she's prepared, and I really hope that those of you who are struggling reach out for help, because this is a tough one. It's a daily battle when you're dealing with anxiety, and sometimes it's hard to kind of face the day and the challenges ahead.
Yeah, we talk about anxiety sort of on a spectrum, and a person sometimes doesn't know that they're pushed right into the sensation of anxiety. So we sometimes say, see if you can put it on a 0 to 10. But it is hard when you're slowly being pushed and you feel like it's your new normal. You're not really waking up you're waking up pushed into this feeling of anxiety. So it is real, it's medical, it's biochemistry, it's on our walls, as a biochemical piece. And it does significantly impact multiple areas of your health. So these are little questions to kind of remind you, that these sensations can actually be anxiety. So do you feel scared? Do you have chest pain? Sometimes your chest pain, especially young people, the chest pain is actually, magnesium deficiency can cause spasm in the chest, and it feels very scary, but it's relieved with magnesium. And do you experience nausea? Do you sweat a lot? Do you have abdominal discomfort? Do you feel quite light and dizzy? Do you kind of feel like your brain is going a little bit crazy? I mean, it's sometimes the anxiety is medical and your body feels separate. You're almost separate from what you're feeling. Do you have numbness or tingling in your hands or feet? Do you have the sense that you're of impending doom or that you're going to die? Do you have more chills or more hot flashes? Do you feel like you're choking? Do you startle easily? Do your hands tremble? Because that could be a lot of adrenaline in your system. And do you wind up avoiding situations just because you don't have the kind of the bandwidth or the ability to handle the extra anxiety that it takes to manage kind of the situation you didn't find hard before? Do you find it hard to sit still? Do you have heart palpitations? Do you push and procrastinate? And does your mind race, either just resting or when you are trying to initiate and maintain sleep, if you're woken up and you can't get back because your mind just is on this conveyor belt? These are signs of anxiety, and there can be ways to mitigate it, especially so you can kind of get back to feeling like yourself. The biochemistry of anxiety is that your body probably is producing way too much adrenaline or fight or flight. It is a hormone that your body is supposed to be more in control of. Exercise is a great way for fight or flight to be released in the body. So is getting excited about things. Those are good pieces for fight or flight. But if your body is waking up in fight or flight, and it's really taxing for the body, and it doesn't feel stable because it's not, and there's a cost to it. The adrenaline will constantly wreak havoc on the system, and it will decrease nutrients in a very aggressive way, but it will also put pressure and stress on multiple areas of the body. So when you look at things like stress or anxiety, there are actual ways to test for them. You can look at adrenaline testing or actual cortisol testing. And then the anxiety also could be things like thyroid function is off, or even there's inflammatory markers that actually can result in anxiety in the system. I think the thing we're worried about is people kind of saying, this is my new normal. I'm just an anxious person. That's me. And we know that it's a bit risky. We know that long-term anxiety can actually put pressure on the cardiovascular system. So it's a real piece, and it's something that we want sort of you not to necessarily say this is my new normal or I am an anxious person if it winds up being very medical. And there's strategies we can do to decrease inflammation, to stabilize the neurotransmitters, or just to figure out what is going on. Why is your body resulting in anxiety? There's a condition that's a little bit more common called POTS. POTS is when you stand up, your heart rate goes really fast. That's a medical condition that does have anxiety as one of the symptoms, but it's very medical. So we'll just make sure that your system is being supported, and there's great naturopathic support that does relieve anxiety or medically assess it if you're kind of on the right mechanism or on the right track. So anxiety or adrenaline has to be broken down by magnesium, and B12 or a methyl unit actually cuts up the adrenaline in the liver. Your body, when it has lots of adrenaline, will deplete tons and tons of B vitamins. And then things specifically for anxiety, there's combinations, and I know whether the label is offensive or not offensive. Like I get offended when I take mood support. I can take it myself, but if someone tells me to take mood support, I get a little offended. But I feel like if I do feel more anxious, this combination of herbs that helps my anxiety, I can feel it kick in within 20 minutes to an hour. So, that's not my choice. I didn't choose to be anxious. If a supplement can help down regulate, then it's more medical, and it's taxing my system. So there are many different ways your naturopath can support the anxiety portion of your biochemistry. We just tend to work up a system and have expectations that it's going to be of service to you quickly. Things work within a couple of hours to a couple of days. So when you're looking at a plan, if you're on a plan that doesn't work, the mechanism has to be changed a little bit. And sometimes we'll actually do things like a neurotransmitter testing, because the adrenaline piece is something that is the cause of anxiety. Sometimes your adrenaline is not too high. You're not making tons and tons of adrenaline, but your body's latched on to adrenaline being the control in the system. So cortisol tells the body it's daytime, it's a good gear. Adrenaline tells the body to fight or flight. Your body has to decide who to listen to. You're supposed to listen to cortisol mostly throughout the day. If your body has decided to grab onto adrenaline or fight or flight, it doesn't matter the levels. It's still the wrong choice. The stress system grabbed the wrong choice. So we want to sort of allow the system to shift over and be more in the regular gear. So these are a couple of combinations that we do like. What are ones that you like, Sonya? You're on mute.
Oh, I'm always on, because I'm so fidgety, right? So it's funny because when you talk about your presentation, I always think about my population, right? So I'm trying to pull up this part of my manual, which probably won't come up. But if you guys, again, if you haven't seen this manual, it's a great resource. It's not working super quickly for me right now. So I'm just going to pull up my actual website where you guys have probably been on this, treatautism.ca. Keep in mind that people who do have children with autism, typically they have medical issues related to methylation. Okay, so methylation, as you guys know, if you work with me, is a cycle that governs development, but it also governs the production of serotonin and dopamine. So if you look at something like B12 injections, again, I have a lot of these folks that I treat, the little ones on B12, because B12 is the rate limiting step really for methylation to produce things like serotonin and dopamine. So these are my favorite wheels here, which I was trying to find. They are in the manual if you have it, but they're also on this part of the website. So if you look at the folate cycle in families who do have methylation issues, 90% of kids with autism do. Their parents have been shown to have methylation issues, and even their grandparents. So when we look at dietary intervention, keep in mind that synthetic folic acid coming in through the diet is going to slow methylation. It's going to slow it by actually slowing the pink wheel, because the pink wheel has to convert synthetic folic acid into active folate, or methylfolate, or methyl tetrahydrofolate, which is, the long name. And also the propionic acid in the grains that stops them from becoming moldy. This preservative actually leads to intracellular B12 deficiency. So if you're a methylation family, then my favorite intervention, as probably most of you know, is methyl B12 injections, a good B complex, and removing or reducing the synthetic folic acid within the diet by taking the grains out of the diet. And then, as you were talking, Chris, as an adult myself with ADHD, I mean, sometimes I look at that, I've looked at that list and I think, well, is it ADHD or is it anxiety? Again, these are stressors on the body. So if you're a person who is anxious, you've been diagnosed with anxiety, you're a person with ADHD, or you have ADHD types of symptoms, don't despair, because you can then take a look at the literature like Carissa showed in something like the cardiovascular system and say, well, I'm going to protect myself. I am a person with anxiety. I am doing my best to manage that in many different ways, but I also then want to protect my system because it's under more pressure, right? It's like a car that's driving at a higher speed on the highway all the time. That car is going to have more TLC. You're going to have to service it more. So we love fish oil, we love B12, we love mitochondrial supports. And I think that's kind of what I wanted to touch on there, in addition to curcumin. or curcumin. I never say it properly, but curcumin is, it's anti-inflammatory. It helps to increase blood flow in the brain. It improves focus and memory. And I think that the inflammatory component here can be really supported through both diet and through some of the supplements. So that's kind of what I was thinking. Lots of kids with autism have anxiety and they can't tell you, so they show you with behaviors. These treatments dramatically improve quality of life for everyone, including the child who is feeling anxious, because their system biochemically doesn't support the production of serotonin and dopamine at the right level. So then they have a lot of glutamate. So when we're looking at treating or supporting children with anxiety who have a diagnosis of ADHD or autism, or even to a large degree OCD and Tourette's, because all of those have too much glutamate, you may need to get into the GABAergic system. So GABA, providing it through a supplement, maybe like Relax Max, right? Or high dose B6, which converts the glutamate into GABA, and acetylcysteine, which is really gaining steam in the mental health world, or especially the pediatric mental health world. It's very safe, converts glutamate into GABA, and herbs like kava, which are really safe for kids and give the brain more GABA to calm down. So that's the sort of the other layer, I think, with people who do have already have a diagnosis. There is another video on POTS. If you do have POTS and you haven't watched this, our video, it's at the YouTube channel, Doctors Doherty Natural Care Clinic, or you can email the clinic and we can send it to you. Yeah, if you have any questions, you can always reach out. We'd love to be supportive. It's tough to live with anxiety, and keep in mind that anxiety, like anything else, is a spectrum. So if you are anxious or you are a person with anxiety, it can be at this end where everything is really, really hard and almost seems impossible, or you can get to a point where it's much, much more manageable, improving your quality of life.
Thank you. Have a good day.